Hi, I'm Charlie from Chadwick Optical, and today we are going to talk about visual impairments. Normally everything's going good with the eyes, but chances are if you found Chadwick, it's because not everything is as good as it could be. I'm going to talk about the various places that things can go wrong and what they might look like and what you might do for them. First of all, the job of the cornea and the lens is to focus the outside world image clearly onto the optic nerve. If it's not doing that job, you need glasses. Glasses go here and fix that image so that this plus this plus this puts a clear image on the retina. When you get to be over the age of 40, this lens starts to harden up and doesn't flex and focus as much as it used to. And then you might be able to see clearly distance, but you need reading glasses. Or you might be able to see, or you're blurry far and you need glasses for that, but then to read, you need to take your glasses off. If you're over 40, you may resonate with one of those two scenarios. Now, the other thing that can happen to the lens, and this is normally when you get even a little bit older, 60s or 70s, is this lens starts to fog up. So it gets white and foggy and cloudy. That's called a cataract. And the solution for a cataract is they remove this lens entirely and they replace it with what's called an IOL, which is an intraocular lens. Oftentimes, the IOL can also correct for your eyeglass prescription. So you wouldn't need glasses anymore after your cataract surgery. So that's kind of neat. Oops. So let's talk about what happens after that. So now you have a clear image on the retina, and it gets sent down all these pathways to the visual cortex to be seen. I'm going to talk a little bit about what happens if these pathways get obstructed, and then we're going to talk a little bit about what can happen with the retina itself. Now, with a stroke, one of the things that often commonly occurs, which is about 1 in 3 patients, is one of these sides gets kind of obliterated. And what happens in that process is now the person cannot see on one side. That condition is called Homonymous Hemianopia. And that condition sucks a lot. Why does Homonymous Hemianopia suck a lot? Let's dig into that. While we're digging into that, before we dig into that, we're going to dig into some more stuff, because the reason that Homonymous Hemianopia sucks is the same reason a lot of low vision conditions like retinitis pigmentosa and glaucoma also suck. So this is the retina. This whole big red thing is the retina. And with that retina, you can see about 180 degrees, 190 degrees of the world. Sure. And all the data that your retina collects from the outside world gets sent down the optic nerve and then processed. What if there's a flaw in the retina? Like, say there's a big, just issue right there. What happens is that area you can no longer see. But the way that you can no longer see it is nothing like the way that it's indicated in photographs of what it's like to be blind. And to show you kind of what a scotoma or what a visual field loss is like, we're going to do this physiological blind spot test. So the image that you see on the screen is 2 dots. One is a blue dot on a light border. The other's a light dot on a blue background. And if you close your left eye and look at the left dot with your right eye, you'll find there's a distance. So the blind spot in your eye is about 15 degrees off of where you focus. So about 15 degrees away, depending on your screen size, it can be a great deal of difference. But if your screen size is about 20 inches, a standard kind of monitor, the distance you're going to be is about a foot if you're looking at the video on full screen. But adjust the distance, because I promise you this blind spot doesn't exist, and if you can't see it, it's because you're not at the right distance to be able to see it. Now, what you'll notice is that when you do find that right distance, the light dot on the right side completely disappears. That area, that spot, is called your physiological blind spot. And that physiological blind spot is where your optic nerve is coming into your retina. When you have an issue with your retina, when you have homonymous hemianopia, when you have pretty much any kind of degradation that's a low vision condition, you don't see it just the same way you don't see your physiological blind spot. Now, imagine you can't see something on half of your body, and what would that be like? You would probably be running into a whole lot of stuff because you don't see anything, but you also are unaware that you don't see anything. And that is the challenge with so many of these low vision conditions, is that the patient is not cognitively aware of their visual field loss any more than you're cognitively aware of your physiological blind spot on a moment-to-moment basis. And that is all of the retinal and the corrective things. Let's talk a little bit about brain injury and the vision issues that happen with brain injury. Now, these are all pretty easy to measure. So we have visual field tests that can measure if you have a healthy retina and can measure if you're blind in one spot and can see in another. There's really not a test with a concussion that would show you how bad your vision is and why. There's some eye tracking tests and that sort of thing that generally tell you, hey, your vision's in a bad place, but there's not really a quantifiable, like, here's the problem. Like, it's hard to pinpoint. But after concussion, a lot of patients will have migraines, light sensitivity, headaches, a lot of symptoms that are indicative of their visual system just using too much energy. And that's another visual impairment, and it's still relatively fresh in the medical community, and we're really still learning to understand the implications of it in many cases. That said, there is help for brain injury and vision recovery in brain injury, but it's not necessarily as solid. We don't necessarily understand it as well as we understand some of the retinal and brain, like a stroke-related vision impairment.